Good morning and welcome to our meeting focused on the update of the Human Services Transportation Plan for the Charlotte region. I'm Luba Zue with VHB and I'm joined by some other VHB team members and also CATS staff members. Today we're going to review our team participating on the meeting. We're going to look at the study background and overview, and we're going to review some of the findings from the demographic data, and then we'll jump into the discussion to see if there's particular thoughts that participants might have regarding transit service needs and gaps in the Charlotte region or some of the key destinations that might not be served yet. So with that, we'll go ahead and jump into the speaker introductions now. So as already mentioned, I'm Luba Zuva. I'm Senior Transportation Planner with VHB Charlotte team, and I'm happy to be supporting the Human Services Transportation Plan update for CATS. And I'll turn it over to Emma.
Hi, good morning, everyone. My name is Emma Stogner, and I'm a transportation planner with the Charlotte Area Transit System, aka CATS. And I am the project manager on the CATS side, at least. So, as far as any questions about or needing a contact point, feel free to reach out to me. But excited about this process, and thank you all well, thank you for being here.
Thank you. And Brian?
Yes, hi, good morning. Brian Horton with CATS as Strategic Planning Manager, just here to help Emma in support role. If there's any questions related more to our broader service planning, but Emma's the key contact for the Human Services Plan for CATS. Happy to be here. Thanks for all those who could join us or be watching later.
Great. Thank you, Brian. We're also joined by Alan Belniak, Sonia Berla, and Jorge Luna from VHB team, and they'll be also supporting this meeting and recording today. Next, we'll proceed with reviewing the study background and the purpose. So a big part of the reason why CATS is updating the Human Services Transportation Plan is there's a specific type of funding from the federal side dedicated to the mobility of seniors and individuals with disabilities. We call it FTA Section 5310 grant funding. And this funding comes down through two different categories. One category is allocated specifically to urban areas over 200,000 population. So Charlotte region falls under this category. And then the other funding category gets passed through the state DOTs to serve rural areas and smaller urban areas. So again, for the Charlotte urban area, we do receive this allocation of federal funding every year that's dedicated specifically for the mobility of seniors and individuals with disabilities. For example, in fiscal year 2023, there was approximately 1.47 million designated for the Charlotte urban area. And coordination between transportation and human services providers is a key requirement of this grant funding program. And then as part of this coordination, a plan update is expected every 5 years. For the purposes of the study, CATS is our agency managing this plan update. And when the plan is finalized, we expect in the spring, it will go through a review by the Charlotte Regional Transportation Planning Organization Board, and also will get approved at the Metropolitan Transit Commission meeting as well. Looking at prior plans, there was a plan update in 2016, looking at the Charlotte urbanized area at the time, and then more recently there was a 2022 plan update, which looked at the Charlotte urban area and had a 2022 through 2027 timeframe. So again, this 2022 plan update was fairly recent, but we had to come back to you all and update this plan again because since then there was a change in the Charlotte urban area. So the U.S. Census designates urban area boundaries, and they update those every 10 years. So the last time that the boundary was updated was in 2022. At that time, there were a couple changes to the Charlotte urban area. For example, municipalities of Marshville and Statesville were no longer included in the Charlotte urban area. The new urban area is showing up in green on this map here. Also, there were portions along kind of the boundaries of the region where they got reallocated to other urban areas nearby that included portions of Catawba County, Lincoln County, Western Mecklenburg, Eastern Union, and Northern Iredell counties. So those areas went to join other urban areas nearby. So that was, again, part of the reason why we're updating the plan again. In addition, we have been seeing a lot of changes in travel patterns post-pandemic. So that was another reason to revisit this coordinated transit plan. As part of the plan update, we are coordinating with and reviewing the information for a number of transit agencies. So in addition to the transit agencies that are operating directly here in the Charlotte urban area, there are some transit agencies that travel from outside and bring their transit riders and passengers to the Charlotte region every day for a variety of purposes, such as medical and maybe other key destinations. So the slide here illustrates the agencies that we'll be talking to and reviewing the data for. That includes Anson County Transportation System, Cabarrus County Transportation Services, Gaston County Access, Iredell County Area Transportation System, Lancaster Area Ride Service in South Carolina, Transportation Lincoln County, Charlotte Area Transit System, of course, Mecklenburg Transportation System, Union County Transportation, and York County Access in South Carolina. And also Central Carolina Regional Council is another key stakeholder agency that doesn't provide transit services directly, but is a key participant in transit planning for the region. Some of the key tasks we'll be undertaking as part of the plan update include facilitating public and stakeholder engagement. So as part of that, of course, we're holding this meeting today and then an in-person pop-up meeting next Friday. We are reviewing the demographic data and key destinations for the region. We are reviewing the existing transit services in the region. We'll be developing a prioritized list of transportation needs and strategies, and then reviewing the 5310 grant funding selection process, and then preparing the final document. Looking at the schedule for this update, we've started in July of 2024. We've assembled the study review committee and held the first meeting in August. We're currently in this area where we're reviewing the existing plans and demographic data and also evaluating existing transit services and also undertaking stakeholder interviews and community input sessions. So you see that blue arrow on the bar to the right. That's kind of where we are with the community input sessions. Further, we'll also be looking at the FTA 5310 funding selection strategies and developing a prioritized list of transportation needs and strategies. We'll be holding 2 additional study review committee meetings, and then in February, March, we'll be finalizing the draft plan and preparing for final presentations. We wanted to mention also that we will be holding that pop-up public engagement next Friday, November 22nd from 10 a.m. to 1 p.m. at Ella Scarborough Community Resource Center off Eastway Drive. That's a wonderful new community resource center in Mecklenburg County. It is accessible by transit. So we hope you can come join us at the pop-up public engagement meeting. Just come by anytime during that time and provide feedback that way if you have a chance. And again, after the current round of public engagement in the stakeholder interviews, we'll be working towards developing our list of public transportation needs and gaps and a list of recommendations, and then the draft plan in February, March, prior to the FTA 5310 funding call in the summer of 2025. Next, we wanted to review some of the demographic data findings for the region. So, of course, reviewing the demographic data is what helps the study team identify where some of those existing needs and gaps in terms of the services. First, we looked at the concentration of minority population, or what we're also calling BIPOC, or Black, Indigenous, People of Color populations. So the map here illustrates some of the concentrations of those populations across the region. And we just wanted to highlight a few areas where we're seeing that concentration, a particular higher percentage of minority populations in the region. That includes the crescent of Charlotte, which are those areas to the west, north, and east of Uptown, Pineville, kind of in South Mecklenburg County, US 74 corridor through Union County, Rock Hill in Lancaster County in South Carolina, as well as Gastonia and US 601 corridor in Cabarrus County. Those are some of the areas where we are seeing concentrations of those populations. The next map illustrates a concentration of individuals with a disability. And this data is a little bit different than looking at the minority population concentration. So here we're seeing a concentration in Western Charlotte and a lot of prevalence across the rural parts of the region. So rural areas of Cabarrus, Lincoln, Anson counties, as well as Ardell County, and also US 521 corridor of Lancaster County. So the darker areas on this map again illustrate that higher percentage of populations with a disability. The next set of data we looked at was the prevalence of limited English proficiency households. And as you all know, Charlotte region is home to quite a diverse population. People are coming from many different countries to live in this region. So this is illustrated also through this limited English proficiency presence. For this data category, we are seeing again the crescent of Charlotte highlighted. So that's west, north, and east of uptown Charlotte. For example, Albemarle Road, which is one of the corridors of opportunity that the city has been studying, has a high prevalence of limited English proficiency households. Also, US 74 corridor through Monroe and Union County, Gastonia, Mooresville and Statesville and Iredell County, and Lincolnton and Lincoln County are some of the areas where we're seeing a higher prevalence of limited English proficiency. The next data category we've looked at is the prevalence of low-income residents. And here, again, the darker areas represent a higher percentage or higher presence of those populations. The crescent of Charlotte, which is the areas west, north, and east of Uptown, we're again seeing that prevalence of lower income households, as well as Monroe and Union County, Gastonia and Gaston County, Wadesboro and Anson County, Statesville and Iredell County, and US 601 corridor in Cabarrus County. The next category we looked at was a concentration of older adults. So again, looking at seniors here, and this population dispersion is a bit different than some of the other population categories. We saw quite a bit of prevalence in the South Charlotte area between I-77 and US 74. So that's the area sometimes known as the wedge of Charlotte. Also, surrounding municipalities in Mecklenburg County, Huntersville, Cornelius, Davidson, and North Mecklenburg. We are seeing a prevalence there of older adults, also Mooresville and Statesville in Iredell County, Monroe, Indian Trail, and Weddington in Union County. Also, we see a concentration of older adults there. Anson County, more generally, and US 521 corridor in Lancaster County. And the next category we looked at was our concentration of veterans in the Charlotte urban area. And as you all know, we have a couple different VA clinics in this region, as well as a VA clinic in Salisbury. But we do have quite a presence of veteran population in this region as well. In Mecklenburg County, we see more or less an even dispersion, so there's not as many clusters, but there's some minor clustering in Mint Hill, Cornelius, and Huntersville in Mecklenburg County with regards to veteran population. We're also seeing some concentration in Indian Trail and along US 74 corridor in Union County, a concentration in Mooresville of Iredell County, and then York County in Lancaster County of South Carolina. I see some concentrations as well there. The next category we looked at was our youth, so younger populations. And so those families with younger children, we see quite a bit of presence in the eastern and western neighborhoods of Charlotte, also Matthews, Huntersville, Cornelius, and Pineville, Mooresville and Stateville, and Iredell County. A lot of communities in Union County, including Marvin, Weddington, Waxhaw, Indian Trail, and Stallings, also Gastonia, Wadesboro in Anson County, and Fort Mill and Kankakee in York County, South Carolina. And then we've also looked at the concentration of zero vehicle households. Of course, having less access to vehicles means that those residents would be more reliant on public transportation. And we're seeing that the crescent of Charlotte, so those areas west, north, and east of Uptown, have a higher prevalence of zero vehicle households. Also, Monroe and Wingate in Union County, Mooresville and Statesville and Iredell County, US 601 corridor in Cabarrus County, Wadesboro and Morven in Anson County, Gastonia and Rock Hill in York County, South Carolina. Those are some of the areas where we're also seeing a prevalence of zero vehicle households, so higher than regional average concentrations. And then when we put all those layers together, what we came up with was our Environmental Justice Index, or EJI. That's kind of the combination of different demographic layers sandwiched together. So that's looking at the prevalence of BIPOC populations, so Black, Indigenous, and people of color, individuals with disability, limited English proficiency, low income, seniors, youth, zero vehicle households, and veterans. So when we combine all of those 8 categories together, the areas in orange and red mean that those areas have a higher prevalence across multiple categories, across 6, 7, or 8 categories of those populations, that there's a higher than regional average presence. And so for those orange and red areas where we see this kind of combined concentration of populations of concern, we are seeing that the crescent of Charlotte pops up. So that's again the areas west, north, and east of Uptown, Monroe and Union County, Statesville and Iredell County, US 601 Corridor and Cabarrus, Anson County more broadly, Gastonia and Lincolnton, and also Rock Hill in South Carolina all kind of show up as a concentration of those areas of environmental justice index. So again, areas with multiple demographic parameters that would be of concern, or they might have transportation disadvantages. So in addition to reviewing the demographic data, as part of the study, we also took a look at the community destinations. So the hexagons that you might see on this map, and they're kind of showing up in purple for denser clusters of destinations, those represent the destinations across the region. Those might be government offices, health clinics, other key destinations that people would need to be able to access in their everyday life. And then overlaid on top of those concentrations of destinations, we're also showing on those 2 maps the existing public transportation routes. So the blue routes, those are the regular fixed route services, bus routes. There's a teal line for light rail in Charlotte, and then the yellow lines represent the express bus routes. There's also a couple hatched areas that represent Gastonia Microtransit Service Area, Mint Hill Special Transportation Service Area, and also the dotted areas represent ADA Paratransit Service Area for CATS. So kind of looking at this overlap, we are seeing that there's still a number of areas across the region where there's a concentration of destinations, but they're not connected to existing fixed route services. There's community on-demand transportation, of course, in all those counties around the region, but in some of them, again, we're seeing kind of disconnect between the concentration of existing destinations versus existing fixed route transit services. And that includes, for example, Monroe and Union County. Also, Lincolnton and Lincoln County shows up quite a bit there. And then there's some additional areas across the region where, for example, South Mecklenburg County and Union County near Marvin, Weddington, where there might be a concentration of destinations, but there's not a corresponding fixed route transit service currently serving those areas. And then we also took a look at the overlap between the existing transit service and the Environmental Justice Index score, so that combined demographic score that we've already talked about, where the areas in orange and red represent those areas where there's a combination of multiple populations with a transportation disadvantaged. So looking again at this overlap between existing transit service represented in blue, yellow, and a teal line, some of the hatched areas for the additional service areas in Gastonia and Mint Hill, and then the ADA per transit service area, that's the dotted area, and then looking at the orange areas that are not yet served by those fixed route additional transit services. Again, Monroe in Union County shows up. Lincolnton shows up. Some parts of Cabarrus County, also in York County, South Carolina. So again, there's still a number of areas across the region where they might have existing community on-demand transportation. They might not always have access to fixed route transit, where there is a concentration of transportation disadvantaged populations. So those are some of the findings just from reviewing the existing data for demographics and the existing transit service. And with that, we wanted to turn it over to our discussion. And I wanted to introduce a couple of our key questions that we wanted to get feedback for as part of public and stakeholder engagement. So we are trying to ask the public and stakeholders what are unmet transit service needs and gaps in the Charlotte regions, and especially for seniors and individuals with disabilities. Are there specific routes, service areas, times of day, or trip purposes that are really hard to meet with existing service? And then the second question, or the second part of this question, is what are key community destinations that might be currently difficult to access by transit? That might be aging services, senior housing resources, VA hospitals, other major hospitals, education, parks and recreation, key government offices, or other key community destinations. So those are the questions again that we're trying to get answers for from the community. So I also wanted to let you all know about a couple other ways where you can find out additional information about the study and provide feedback. If you navigate, uh, if you navigate to concept board, that's the link at the top of the slide. You are able to go there and interact with the maps that we have posted and provide comments in written format. You can just add a sticky note to the map. And you can also learn more information about the study at the CATS website. So the QR code will take you to the concept board. So again, returning to our questions that we are asking community members and stakeholders, we are looking for feedback regarding unmet transit service needs and gaps in the Charlotte region, especially for seniors and individuals with disabilities. And then we are asking for feedback regarding key community destinations that might be currently difficult to access by transit. And if you're interested, I invite you to stop by our pop-up public engagement session scheduled for Friday, November the 22nd at the Ellis Scarborough Community Resource Center from 10 a.m. to 1 p.m. We'd be happy to hear from you directly if you want to stop by and chat with the study team. And we'll also leave the concept board open for a few weeks. So if people want to go online and navigate to the concept board and provide some feedback that way, that would be great as well. And with that, we wanted to say thank you for joining this presentation of this recording and learning more about the CATS Human Services Transportation Plan update. Please reach out to study team members if you have some specific questions. I appreciate your time today, and thank you.
Thank you, everyone.